Hello friends, I'm Dr. Davidson. Today I'm here to talk to you about why you need an integrative healthcare consultation. But before I get into that, explain what that is and why you need it, I'd like to take just a moment to reflect on our current conventional medical system. Because you see, when it comes to dealing with chronic health problems, our current conventional medical system is simply broken. So why do I say this? Well, when a patient comes to see his or her doctor, the doctor may spend 10 minutes with the patient, not really delving too deeply into why the patient is complaining of their current symptoms. What is causing these symptoms to appear in the first place? What is their root cause? Even if the correct diagnosis is made, the conventional doctor often simply lacks the training to address the factors at the root of the patient's health problems, which are often related to nutrient status, diet, and lifestyle. Now instead, the doctor will simply prescribe medication to suppress the symptoms, which might seem fine. The patient may even forget that there was a problem to begin with. However, it simply does not work. It's like covering up a festering wound with a bandage. The infection continues to spread and the patient continues to decline. Now, often the doctor is powerless to do anything about this except monitor the patient, while the patient continues to pay money just to be watched and decline. A sad state of affairs indeed. In contrast, in integrative medical systems, the practitioner attempts to discover and address the underlying factors at the root of the patient's health problems. To give you an example of just how powerful this approach can be, let's take a look at two case studies. One is a woman in her 60s with a hernia complaining of chronic heartburn. And the physicians hoped that by surgically repairing the hernia, it would also alleviate the heartburn and prevent her from having to take her routine acid-suppressing medication. So they convinced the woman to have this procedure done. Now, the recovery process she described as being even more painful than childbirth and taking over a month. To this day, this woman still has heartburn. She still continues to have to take chronic acid-suppressing medication, which is in itself sad because these medications have a number of deleterious health consequences, especially when taken long-term. They include worsening indigestion, increased bone fragility, increased susceptibility to food poisoning and infections, as well as depletion of essential nutrients necessary for normal physiological functioning. Now let's take a look at a similar example. A woman in her late 60s complained of chronic heartburn, as well as chronic recurring urinary tract infections. After getting no relief with conventional medical treatment, this woman sought my advice. At the time, the woman was also taking routine acid-suppressing medication, as well as frequent courses of antibiotics to deal with the urinary tract infections. I'll call them UTIs for short. So after examining this woman, I deduced that her problems were most likely related to consumption of too much animal fat, which can relax the lower esophageal sphincter, which keeps the stomach acid from going back up into the throat, up into the esophagus, and causing heartburn, as well as due to consumption of animal products that are naturally contaminated with UTI-causing bacteria such as E. coli, and also due to insufficient intake of nutrients necessary for proper digestion. So after examining this woman, I simply made a few dietary recommendations regarding her nutrition, diet, and eating habits and lifestyle. I also recommended some medicinal herbs that would help to protect mucous membranes, eliminate UTI-causing bacteria, and give her the necessary plant chemicals she needs for proper digestion of her food. At this time, the woman is greatly improved. She no longer has to take routine acid-suppressing medication, and last I heard, she no longer suffers from UTIs as well. Was it not Hippocrates, the father of Western medicine, who first said, "Let food be thy medicine, and medicine be thy food"? Have we grown so arrogant or narrow-minded in our current thinking that we have forgotten this very simple and effective wisdom that is so much less expensive to us than having, for example, a surgical procedure, which has a lot of risks of its own? So why should you work with me? Why do you need a consult? My unique approach combines the use of food, herbs, top-quality supplements, and therapeutic lifestyle changes all as medicine. It is so powerful that better than treating disease, it improves health. In the previous example, it improved the digestive system. But beyond this, it also improves the overall health, both of the body and of the mind. Contact me at drdavidson.integrativemedicine.com and request your free 15-minute introductory healthcare consultation. Get back on the right track to regain control of your health.